epidemiology, and I will explain it in a short time matter of what is epidemiology information. So epidemiology information is people who have in the community. So we have two sectors: the unaffected disease and the one who is already affected. So the uninfected one is we are going to educate them on how to prevent these kind of disease, such as washing your hands and performing proper hygiene around the community to prevent, and wear proper PPE or face mask will do. That is one of the sections of epidemiology. And we have the epidemiology management. Those management to those people who are already infected with the disease and how to manage their disease when it is already acquired, like going to the doctors, getting your checkup, your medications, everything, and protecting yourself to not affect others. And that is management. So this is the definition of epidemiology. Another one, it is a disease that spreads throughout the community or a large group of people. It says here that epidemiology is a study of how often disease occur in different groups and why it is also the control of disease in the population. Occurrence and distribution of health and disease in a defined population. So it says here, epidemiology is a study. So we study the disease that occur or how mass it spreads among the community. And right now we are going to tackle one of the diseases that we are going to present today.
Hi everyone. For this case study, we chose Monkeypox or Mpox as our focus. It's a viral disease that made headlines globally and has recently emerged with new cases, including here in the Philippines. In 2020, the World Health Organization declared Mpox a public health emergency of international concern. And although cases drop over time, small outbreaks continue. In this case study, we'll look at what Mpox is, how it spread globally, and we'll highlight a recent local example from Davao City in April 2025. Monkeypox is a zoonotic virus, which means it can be passed from animals to humans. People can get infected through close physical contact with an infected person, their bodily fluids, or even contaminated objects like bedding. The common symptoms include fever, fatigue, swollen lymph nodes, and a distinctive rash or skin lesions. Although first identified in humans back in 1970, the virus became a global concern again in 2022, when it spread to over 100 countries, including the Philippines. Our first confirmed local case was reported in July 2022, and while numbers remain low, occasional new cases have still been reported. A recent example happened just this April 2025, when 2 new cases of Mpox were confirmed in Davao City. Both patients were isolated at Southern Philippines Medical Center, but sadly, one of them who had existing health conditions passed away due to complications. In response, the City Health Office quickly activated protocols. They conducted contact tracing, monitored close contacts, and issued public health advisories. They confirmed the virus strain was clade 2, which is considered less severe but still requires careful management. This case reminds us that even with low national numbers, local outbreaks can still happen, especially if preventive steps aren't followed. To wrap up, this case study shows that Mpox is still a relevant public health concern both locally and globally. Even if it's not spreading as fast as other viruses, we still need to be alert. What can we do? We should continue practicing hand hygiene, avoid contact with infected people or animals, and disinfect frequently touched surfaces. People with symptoms should seek help right away, and local health officers should maintain early detection and rapid response systems. Staying informed and prepared is key to preventing larger outbreaks.
Good day everyone, I am Lemmy Santillan and we're going to talk about the recent outbreak, the monkeypox. So, what are the public health response in the Philippines during the monkeypox outbreak? So, they deployed surveillance teams at international airports and seaports, and they required health declaration form and temperature checks for incoming travelers. For the laboratory testing and capacity building, they trained lab personnel on monkeypox PCR protocols and procured diagnostic kits and set up biosafety labs for safe testing. So, for the public communication and health education, they conduct town hall meetings, social media infographics, and media briefings to prevent misinformation. And for the local government unit or for the LGU mobilization, the Department of Interior and Local Government instruct all LGUs to establish isolation facilities, monitor suspected cases, and prepare emergency response teams. So, cities like Quezon City and San Juan set up quick response teams and isolation rooms in hospitals. And for the Davao City, they create a special unit for emerging and re-emerging diseases. And for the post-case monitoring, after the first confirmed case in July 2022, all close contacts were traced and placed under quarantine and active monitoring. And as of mid-2024, all confirmed cases recovered and no deaths were recorded. So, enforce 21-day isolation for suspected and confirmed cases and ensured psychological and medical support during the isolation.
So next guys is prevention strategies, no? Guys, super important talaga to keep ourselves safe from Mpox, okay? So first, what we're gonna do is always wash your hands with soap and water. So gagamit tayo ng mga kung paano ba yung demonstration ng pag-soap and pag-wash your hands, 'di ba? Or use alcohol-based sanitizer lalo na after touching stuff or people na medyo sketchy. Wash your hands agad talaga, and then avoid close contact with people showing symptoms like no hugging, kissing, or intimate ganaps with them. If you need to take care someone na may sakit, make sure na naka-gloves ka and mask para protected ka pa rin. So, we need to maintain na ma-prevent natin yung mga contamination na yan. Also, disinfect surfaces and object na possibly contaminated. Sabi nga nila, better safe than sorry. 'Di ba? And please avoid contact with animals that may carry the virus. Like, don't touch them or their stuff. Kasi, 'di ba, sa mga gala-gala, hilig natin touch nila, magpas na yung mga dog, cat. So, avoid muna natin yon because as these practices, pwedeng mag-lead to the transmission of Mpox from animals to humans. No? So, next is for the conclusion. So, to wrap it up, let's all stay vigilant and watch out for any symptoms, especially sa mga kids and elderly kasi they are more vulnerable sa mga gantong uri ng sakit, 'di ba? So, if you or someone you know start showing signs, don't hesitate, consult a doctor agad. Good thing na may telemedicine service like All Doctor Anywhere, so you can talk to the healthcare provider without leaving your house. So, early diagnosis and treatment are key para hindi kumalat yung mga gantong virus. So, let's all do our part to protect ourselves and our community. Okay? That's it for today, and thank you for listening.